Florence Crittenton is a nonprofit in Helena that historically has provided services to young pregnant women. But for the last 5 months, the residential programs have been suspended. I sat down with the executive director to find out what's going on. For over 100 years, Florence Crittenton has been working in Montana, offering residential programs for young pregnant women and children. Now things are changing.
We've always tried to be responsive to the needs of our clients and analyze that periodically over time. And I think it's become increasingly aware in Montana that there's a huge issue with substance use.
Executive Director of the Helena nonprofit Barb Burton says building a comprehensive residential substance abuse treatment program was necessary.
Nearly 95% of our clients had what we call co-occurring disorders of mental health and substance use.
Burton says this idea has been in the works for over a year and a half, and 5 months ago that idea was set into motion.
What we had to make the very difficult decision to do was to temporarily furlough some staff. I can't remember what that number was. I think it was 9 maybe that initially were affected.
This is an email that Florence Crittenton sent to its donors dated August 2nd, explaining the changes in the programs and saying the new services will be geared towards substance use disorders. In this email, it also talks about suspending the programs, including furloughing some of the staff. Now, Florence Crittenton told me the last day those staff worked was August 11th, and as of now, the programs have yet to be restored. Suspending the residential programs came at a time when they weren't serving many clients.
We had made the decision to temporarily lay things back because we were a little bit lower in census at the time, and there were very few people that were affected. We kind of gauged that timing on when people would naturally transition out of the program. Okay. So it wasn't as though we kicked anybody to the street or just said, now you have no place to go.
The organization says part of the reason for these changes, money or lack of it. When the staff was furloughed, the remaining staff, including directors, took pay cuts. For the first time in 3 years, Florence Crittenton Services had less money at the end of the year than it started with $384,945 based on the federal income tax form 990. This new substance abuse treatment program will begin with the help of a Montana Healthcare Foundation grant of $75,000. Up to 4 clients and their children will be able to participate in this new program.
Obviously, we're all concerned about how drugs affect our communities, and I'm also really excited to see the change that this could have overall on young families.
Burton says while the foundation of the residential program is changing, the clientele is not.
We're still working on that same demographic of young women up to the age of 24 in our residential programs where we can wrap all of those services around them.
The community-based programs that Florence Crittenton offers are still running, but the timeline for the other services to resume is unknown.
You know, there's a lot of moving parts when you do this. And, you know, a lot of it just depends on how soon we are completely staffed up and ready to go.
Burton added they anticipate hiring between 8 and 12 staff members, hopefully some of the previous employees. Now, Florence Crittenton also got a federal grant to launch a program for runaway and homeless pregnant and parenting women. You can read more about that online at ktvh.com.